Welcome to the Chronic Spoonful podcast, where we discuss real life with real chronic illness. Each week, we'll cover an aspect of real life spoonie living and what that can mean for different chronic illnesses. We hope this will be a place you can go for updated spoonie info and where you'll find humor, because, we're a little crazy, important information, and community. As a disclaimer, we just want to remind you that yes, we'll be talking about chronic illness and health information, but we are not your doctor. Everyone's chronic illness is different, and we are absolutely not MDs, so we are not qualified to give you medical advice. We're going to tell you unequivocally to discuss anything we talk about on this podcast with your doctor. All right, welcome back, everyone. Welcome back. Now we've gone through all our disclaimers and gone through all the fun. And, well, we hope you all had a good week, a great week, a wonderful week, and, not such a bad week, maybe. Just a week. Something. So let's go through our new and noteworthy this week. And I don't really have anything new and noteworthy this week. It was just a week of normal weakness. But Nicole, you've got something new to share.
Yeah, I read this article, which is really exciting. Austin Regional Clinic in Texas actually started their trials for the COVID-19 pill. So, which is really exciting. So what this pill is for is it's going to be basically like a Tamiflu for COVID. It will treat, they're hoping that this is going to lessen the symptoms. If you receive this pill, you would take it twice a day for 5 days. And basically what they're saying is it is going to prevent you from having to go to the hospital or have such severe symptoms where you need to be vented or in the ICU. But it does not work in replacement of the vaccine. You would still have to be vaccinated. But the pill is just like another additional bonus that would help you not have to be in the hospital, which is amazing. So they're saying the ARC clinical research is enrolling 3 types of people in the study: low risk individuals who have tested positive for COVID-19 in the past 72 hours, high risk people who have tested positive for COVID-19 in the past 72 hours, and people who are in a household, the same household as a person who has recently tested positive for COVID-19. So that is super exciting. So I'm really excited about hearing the rest of the data and how these trials come out. And what they're saying now is Pfizer is hoping to release this pill by the end of the year.
Which is amazing because, we're looking right now we're going through the Delta variant surge at the moment. So we're looking at 4th of July surge, all these concerts, a summer surge from people going on all these vacations and outdoor concerts and all this. And then we're going to go through the start of school surge that we're going to see.
Yeah.
And we've got these other variants coming and hitting the mix. And then people are going to start going indoors again as the weather gets cooler. So, and I know that they're worried about a winter surge happening as these now other variants are going to start hitting. So having that pill hit at the end of the year is kind of really good timing.
Oh, it would be wonderful if everything goes okay and they can actually release it by December. That would be amazing. Because people are going to get together for the holidays.
Oh yeah. So, I mean, you've got Halloween, you've got Thanksgiving,
Christmas,
Hanukkah, Christmas. You've got the high holidays for people who are Jewish. You've got all of that coming. So I mean, I know, like I say, I still think people need to be very cautious. I don't think people should be like, oh, cool, this pill's going to come out. We can start together.
No.
Absolutely not.
No.
You still need to wear a mask. You still need to get vaccinated. You still shouldn't be planning big parties or anything like that. But it's just, what it's showing me is that, science is really moving forward and they're really pushing to get more and more treatments and more options for people.
Super exciting.
So especially I know that they're talking about using this for people who are vaccinated, But I think this is also some hope for people who can't get vaccinated, maybe.
Yeah, because I guess the article had said they need the people to be unvaccinated to do the trials or something.
Yeah.
So that is really going to be exciting to see how it'll turn out. And if it does work, what they did also say when I was reading through it, that everybody's body is different. So say the pill worked for the majority of people, it doesn't mean it's going to work for you in the exact same way. So like Kelly said, you do still have to be careful and limit your exposure, stuff like that.
Yeah.
Wear your mask.
This is still exciting news because anything we can do to fight off this virus, any tools we have is one step forward. I mean, it's huge. And so I'm really excited about this. And I'm hoping that we can find more things to help fight this because, again, it's one tool. It will work for some people. I'm hoping we can have more tools like this coming. I think this is one big step for us. And hopefully there's more steps.
Oh, yeah.
Yeah. So I'm really excited about this news.
Me too. I'm thrilled. I was so excited when I read it.
Yes. It's a very, very positive thing this week. So happy time.
Happy news.
Happy news. And we need it because this week was not a very happy COVID week. And we're not going to go into all that. We're going to stay on the happy news of the happy Pfizer pill. Thank you, Pfizer.
We love you, Pfizer.
Today.
Maybe tomorrow Moderna will come out with something else and we'll love them more.
Right. Today we're going to love Pfizer.
Yes.
So, all right. So that kind of brings us to our topic of this week, which is a serious topic, because we're just sitting here talking about taking pills and, making a decision of taking pills. And we're going to talk this week about the Patient's Bill of Rights, which sounds very serious. And it is very serious because I think a lot of people don't know that they have rights. So, we're sitting here talking about people getting vaccinated, not vaccinated, and, rights are constantly coming up lately about vaccinations. It seems to be the buzzword, but that's not what we're actually talking about when we talk about the Patient's Bill of Rights. The Patient's Bill of Rights are the rights you have when you are in the medical office or in a hospital or clinical setting. And I think that what I've seen lately is that people actually don't know that they have these rights. And it's kind of it became like alarm bells were really ringing for me with the number of posts I've been seeing on social media, with the number of questions I've been seeing asked in the groups that I'm in, or the number of stories I've been reading from people that they didn't know about their rights when they were in these clinical settings. And I got very concerned, not only that they didn't know their rights, but actually that their clinical settings were violating their rights. And when I was talking to Nicole about this, we decided this might be a good episode to do because we really feel that, especially because we suffer from chronic illnesses, we want to make sure everybody knows their rights when they're in a clinical setting. I know we did an episode on how to get, from your doctor what you need, and that's a little bit different. That's just advocating for yourself, asking for what you need, to get certain types of medical care. But we didn't go deep into actually what your rights are. And so I think today we're going to go more into the actual Patient's Bill of Rights.
It's really good to know. It really is, nursing homes, hospitals, any kind of clinical setting. It's really important to know what is rightfully yours and what you can rightfully expect and what should be happening to you.
But I also wanted you guys to know where it came from, because it's not like we just chose this topic out of nowhere. It actually came from a lot of stories of people not knowing that they could, that some of these things that were happening to them were actual violations of the Patient Bill of Rights. And the Patient Bill of Rights is actually part of the Affordable Care Act, you guys. So this is not it's just something nice to have. This is actually part of this act of law.
Yeah.
So you guys realize you have every right to what we're about to talk about. And hospitals and clinical settings need to provide these things for you. Okay, so let's dive in. Let's dive in,
Great.
Nicole.
Okay. The
Why
first
don't,
right.
why
The
don't you?
first right is to safe, considerate, and respectful care provided in a manner consistent with your beliefs.
Okay. So that just means you have the right to respect. To respect in the setting. It means you should not be discriminated against. It means you need to be treated with dignity. It means, they can't you shouldn't be discriminated against because of your sex, your race, your age, your ethnicity, your religion, your sexual orientation, your gender, your veteran or military status, your religion. So basically anything that's prohibited by federal, state, or local law. This seems so easy, right? And yet we see this happen very subtly all the time.
Most
And this is
definitely.
one that I think we see frequently. I especially see it with transgender people. I especially see it with women and with people of color, where we've seen studies show that women of color, their pain symptoms are often dismissed. And there's this pervasive notion that women of color just don't feel pain at the same level that white people do. I don't know where this idea comes from.
It's so disgusting.
It's disgusting and ignorant. And so they don't get the care that other people do, which is why you see, especially in like maternity wards, the mortality rate of women of color, of those mothers, is so excessively higher than white women. It's, if you go through the studies, it will make you sick.
It will. I read those and I was so disgusted.
And also why women as a whole, their symptoms are often dismissed, and why we have to often fight harder to have our symptoms heard than men. It's also why a lot of our ailments, our ailments are often dismissed too, because a lot of studies have only studied men, not studied women. They haven't included women in their studies, but also doctors will dismiss females' symptoms as just being hysterical.
You're hormonal.
And by the way, I'm seeing this in discussion groups all the time. So I'm sure a lot of you are listening to this going, yep, totally got dismissed the other day. I saw a post just the other day where a woman's symptoms were dismissed as female hysteria, or doctor dismissed. And luckily she went for a second opinion, because, by the way, no one should ever be dismissed as female hysteria, not a real thing. But like older people, a lot of times they're dismissed because it's just like, oh, they're just getting older. It's just, dementia. Like, oh, it's just, they're just older or whatever. These things happen way, way too often. So this is the one area, I think, of the Patient Bill of Rights that we forget exists in the Patient Bill of Rights. And you have the right to be 100% respected and to ask and demand that respect. When you're in a doctor's office. And you have the right to complain about any discrimination you feel. You have the right to report discrimination and to have that discrimination heard. And you have the right to not be seen by that doctor who is discriminating against you.
Without any backlash to you.
So there's no reason to tolerate any degrading treatment by any healthcare professional. And by the way, we're not even talking just doctors. Sorry.
No.
I shouldn't put this all on doctors. Doctors, nurses.
Techs, x-ray techs, MRI techs, ultrasound techs, your nursing assistants, your respiratory therapists, anybody in the medical field, anyone who's treating you.
And this includes like your religion. So I know like, we've had a lot of issues with like people who are Muslim and they might wear a hijab on their heads, and people want them to take that off for random reasons that aren't related to, needing to examine that area, or they won't respect that, a religious reason why a female doctor can't see an Orthodox man in like Judaism or something like that. Like,
your religious beliefs need to be respected when you're in a medical situation. That being said, in an emergency situation where you're unconscious and they don't know, guys. Like,
yeah, that's totally
please
different,
understand
right?
that, and like, don't get Sue happy. Like, please, you're unconscious. They don't know, but they should be respecting your right as soon as they do know.
Mm-hmm.
However, if you say, this is my religious belief, these are the parameters, they need to respect that religious belief. Like, if your religious belief means you can't, let's just say your religious belief means you can't receive a porcine valve, you can't receive that, guys. Like, they can't put one in you. These are just important things to remember. This is a very important part of the patient Bill of Rights. And I'm telling you, it gets violated more often than you think. And it's done in very subtle ways. If at any point you feel disrespected or discriminated against, you can speak up about it.
You can end the conversation right at that moment and say, I feel uncomfortable. I request, this happens in the ER quite a bit with people. They feel disrespected or different things. You can say, you know what, stop. I mean, I'm not talking about, like Kelly said, when you're unconscious, you can't pop up and say, wait a minute. I'm saying if you are conscious and someone is making you feel extremely uncomfortable at all, you say, stop. I want to request a different doctor, a different nurse, a different x-ray tech, whatever.
Yep.
And you have that right.
Absolutely. I mean, that is a huge part of it. So another one is to expect that all communications and records pertaining to your care will be treated as confidential to the extent permitted by law.
HIPAA. Our good old friend HIPAA.
So that is the right to privacy, guys. And I was telling Nicole when we were talking about this, I really wish that when they put up these patient Bill of Rights posters around the hospitals, because they need to, they're required to, or they hand you a patient Bill of Rights, they really wrote these things in easy to read and understand terminology, because like all of this stuff is written in like legalese, and it makes it like, there's some posters that are so, I sent Nicole this one poster and I was like, here, read this one on the patient Bill of Rights. She's like, what is this?
It was so complicated.
Yeah, it's ridiculous. This is not rocket. None of this is rocket science, guys. No, but it's written like it's rocket science. And so it's true. Not. It's just not. This is just your right to privacy. HIPAA is your right to privacy. My favorite part of when you go to some doctor's offices is they'll be like, here, sign on this digital thing. This is saying that this is your HIPAA stuff. And I'm like, do I get a copy?
And they will give you a copy. You may have to ask, but they will give you a copy. You are entitled to that.
Anything you go to sign that's there, a lot of times they'll just be like, okay, sign this. Okay, sign this. And you're like, what am I signing for?
Yeah.
Never sign anything without seeing what you're signing for.
Agreed.
I'm like, you haven't handed me anything saying to read my HIPAA stuff. Yeah, super fun. But this is your HIPAA stuff. This is a real basic right to privacy of knowing who, what, when, where, why, how your private, individual, and identifiable health information is going to be disclosed. So who's going to have access to it, when they're going to have access to it, to what extent they're going to have access to it. In a lot of cases, you can decide who is going to, you can limit who is going to.
Yes, you can.
But this was enacted to prevent any, you from being personally embarrassed, prevent any public humiliation, to prevent discrimination. HIPAA is a very, very important law, because some people will be like, well, it's no big deal. I'm just going to the doctor for a regular visit. But it is a big deal if, say, you were diagnosed as HIV positive. People now live with HIV for years, decades.
Yeah.
But people still see HIV as like, oh, you're AIDS and you're untouchable.
Yeah.
Well, no, you're not untouchable. You're fine. You can work. You can do all these things. You can live a basically everyday life like anyone else. Why would you need to why would anyone need to know? Why would anyone need to know unless you wanted to tell them? Or if you had depression that was being treated? Why does anyone need to know that? They don't. It's your right to have that information private.
Yes.
If you have MS, if you have EDS, if you have lupus, no one needs to know that information unless you want to make that information known.
That's right. No one taking care of you. No one in a doctor's office, a hospital, your nurses, anybody who is in contact with you like that has absolutely, they cannot share anything about you at all.
Correct. And this is anything. This is your medical diagnosis, what treatments you're on,
your name,
health insurance, your health insurance information, your genetic information, your mental health records. Yes, that includes your mental health records. No one can share that either. If you're in a clinical research trial, they can't share any clinical research records. You guys, this is literally anything. The only time a mental health provider can share something is if you are at serious risk to yourself or the public. Like
That's
if
right.
you tell her if you tell your therapist you're going to commit a murder, your therapist has an obligation to tell people you're going to commit a murder.
Right. She can call he can call the police. They can whatever, your psychiatrist, they can admit you, whatever, but that is the only time.
Yeah. And that was done for a reason, because they have to protect the public.
That's right.
But they're not like releasing your medical records to everyone and their brother. They're not putting it on the front page of the paper. Susie Smith is going to go commit murder. That's not what they're doing. They're admitting you to the hospital for treatment to prevent something bad from happening. That's it. And again, it's staying within the mental health community. So guys, like, things need to remain private because it could really, really damage your life if some of this comes out. So this is another really important part of the Patient Bill of Rights. Nicole, you want to do the next one?
The next one is to know the physician responsible for coordinating your care at the clinical center. This
kind of goes along with to kind of choose providers, like to be able to know who's coordinating your care, who's taking care of you, like who's handling your treatment.
Yeah, who's prescribing your medication, all that.
Yes. So for instance, I see a PAC for my primary care, right? She has to be overseen by an MD. I know who the MD is who coordinates that. It's fine. Like, I don't need to see the MD. My PAC is amazing and I love her to death. But if things get complicated, I have had a couple things get complicated where the MD has also coordinated my care, but I'm always aware of who the MD is who's overseeing my PAC. But you have the right to absolutely know who's coordinating your care. That should never be a question. Like when you go when you're staying at the hospital, they put those boards up and they tell you who's your doctor, who's your nurse, who's the
patient care tech. Yep. Oh yeah.
That should always be filled out for you. There should never be a question of who is the doctor who's handling, who's the nurse who's handling. Yeah, that is incredibly important. And if they won't tell you, that's a problem.
And you can ask for the administrator, the charge nurse. You can keep moving up the chain to talk to someone that oversees. Even
the hospital chaplain should be able to help you. A lot of times what you can ask for is the patient advocate. But if it's the middle of the night, there's maybe like one or two patient advocates on, depending on the size of the hospital you might be in. So if they can't get you a patient advocate soon enough, sometimes the hospital chaplain is another good resource because they can help coordinate that too.
And the hospital social worker also.
Correct. Sometimes small hospitals, it's a small staff, so you have to be a little bit patient, but you have every right, and they need to pause your care until you get that person in there to coordinate things. You have the right of refusal.
Mm-hmm.
So that's also a key. You have the right to refuse for them to touch you. You can demand that.
Mm-hmm.
And you can demand that in the middle of your care, by the
Mm-hmm.
way. At any point that you feel uncomfortable, you can demand a different doctor, you can demand different care, and you can demand that they stop touching you. There are limits on that, though, by the way. There are some limits on that. Like if they're in the middle of like a life-saving procedure and have you open, there's a difference between stopping in the middle of a procedure and it will kill you, and stopping in the middle of like, you know that the medicine they're about to give you will kill you and they think that they need to proceed with it.
Right. Or like an exam or something of any kind.
Right. Like if you're bleeding out and they want to put gauze on you and you're screaming incoherently in pain, you need to stop, you need to stop, you need to stop. There's a difference. So understand that too, please.
Yes.
What we're talking about is you being of sound mind and body when you're talking about these things.
Mm-hmm.
I need to just be clear on that one. We're talking about you being of sound mind and body during these moments. To receive complete information about your diagnosis, treatment, and prognosis from the physician in terms that are easily understood. If it is medically inadvisable to give such information to you, it will be given to a legally authorized representative. This is also one I think a lot of us struggle with. I don't know why doctors have a really hard time giving us complete information about the diagnosis, treatment, and prognosis of our conditions, but they do. I think some of it is a hesitancy to actually diagnose us. Some of it is they just want to get in and out of a room so quickly. And you have the right to get all the information you need from
in a way that you can understand it.
Yes. And a lot of times doctors can get caught up in their own heads. They've spent so much time in the medical field that and this happens in any industry you're in, you guys. This is not just about doctors, by the way. This happens in any industry. You get so caught up in the work that you're in the field that you're in. You speak so much in those terms, you forget that other people don't understand them.
It's very true. I do it and I don't even realize it. I'm like, oops.
And we have to remind them. And that is up to us to remind them. This is when we, like on the last episode, we talked about advocating for yourself. Advocate for yourself in those moments because they are going to forget. They're going to throw, most of them, there are some doctors who do remember, but a lot of them will throw these words at you. Unfortunately, they're just going to throw these words at you, and they're big hunkin' medical terms of like, here's your 17-letter diagnosis. Like, how many of you probably the first time you heard something like something random, like here's like Ehlers-Danlos, I think is a really good one because most people outside of maybe a few of us who knew someone who had it, Ehlers-Danlos syndrome, knew what it was.
I agree.
And here I'm going to give you this medicine for it and this medicine for it, but you're going to be fine. It's not deadly. Oh, okay. Thanks. All right. Oh, and by the way, you also have dysautonomia and mast cell, but none of them will kill you. It's fine. And then they walk out of the room.
And, kind of be patient with the doctors and nurses and, other people like, medical assistants, because, even though like I haven't worked as a nurse in a very long time, I mean, a lot of times I would start talking to somebody and not even realize what I was, saying that they may not comprehend it, because that's the way we're required to write in the chart. And we speak with each other like that. And it's really hard to remember sometimes that the other person across from you is not a medical person that might, that will understand what you mean.
Right. So in that situation where they're throwing words out at you, so my favorite thing is to say, okay, stop. I like
yes.
Just use those two words. Okay, stop. Can you explain that in real people terms now?
Mm-hmm.
And a lot of times it just catches them. The okay, stop totally catches them off guard, by the way. because A, they're not used to being talked to that way. And B, it makes them go, what? And then they realize, oh yeah, I'm using terminology this person doesn't understand. And when you say real people terms, then they realize they're speaking in medical terms and you need them to break it down for you. And then you can usually have a conversation. Most of the time, a doctor will have a conversation. If they don't, that's when you fire them and find another doctor. But the okay stop usually works for me. Because first of all, you need a second to digest your diagnosis a lot, like especially when you're in those initial stages. You need a second to understand what they're telling you about your treatment, not just understand like when they tell you they're going to prescribe pills, when you need to take them, but also like, how is that going to make me feel? What is that going to do to me? What should I expect over the next few weeks, few months, a year from now? Like, and yeah, fine, it's not going to kill me, but what effect is this going to have on me?
Mm-hmm.
Like, what effect is it going to have on my life?
Right. Yeah. How is this going to affect me, and put it into terms that I can understand? Like, you're going to be tired all the time. You're going to have times where you're going to be in pain. And if
Right.
you are in pain, these are the options that we have for you. I mean, to break it down simply for you.
What have you seen in other patients that are like me? Other things. So the okay stop gives you both that 1 second to like breathe. Also remember, doctors in hospitals, even in their own doctor's offices, have a certain quota of patients they need to see. So they're a lot of times just moving on. And they're looking at time and time crunches. And you're looking at it from, I need you to explain this to me and slow down. So you're both operating differently. But in the end, it is your right to understand those 3 things. So they have to operate within your right to understand those 3 things. You do have the right to get those things. So they have to slow down for you. It's your right. And you can say, it's my right to understand this. So you need to fulfill that right. And then you have the right to complain about them if they don't meet that right. Okay, Nicole, you want to
And the next one is to receive information necessary for you to give informed consent prior to any procedure or treatment, including a description of the procedure or treatment, any potential risks or benefits, the probable duration of any incapacitation, and any alternatives. Exceptions will be made in the case of an emergency.
So the key is exceptions in case of emergency. Guys, I want to start there because there's a lot of people that think in any situation you have to be able to give informed consent. That's not the case. In the case of an emergency, your life is at stake, guys.
They're going to do what they have to do.
They're going to do what they have to do. And that's the thing with doctors. They didn't get into the field to just play around. They got into the field to save lives.
That's right.
I mean, no one goes to that many years of medical school to just be like, I just want to twiddle my thumbs all day. It's too challenging. Medical school is rough, guys. So if you're sitting in an emergency room, they're going to try to save your life. But informed consent is really, really important outside of that situation. And you have the right of informed consent. You have the right to tell your doctor no. Too many of us are intimidated by doctors. We shouldn't be intimidated by doctors. Yes, they went to medical school for a bazillion years. I respect it because, gosh darn it, they could pass organic chemistry and I hate them all for it. I struggled with that stupid class. No, it takes dedication to get through med school, guys.
Yes.
It's hard. It's long hours. It's competitive. And then you've got to go through residency and internships and oh my gosh, and just bless them because they deal with a lot of crazy things, but it doesn't mean they're God, you guys. And it doesn't mean they know your particular body. they may have only studied your disease for like a week, right? So you, however, may have been seeing your doctors for 10 years about your disease. You might actually know more than your doctor about your own disease, to be honest. The current doctor you're seeing, not your doctor that you've been seeing for 10 years, but your current, like the emergency room doctor. So don't be afraid to speak up. If you think that they're going down the wrong route about what's happening with you, it's okay to say no, and I don't want you to treat me with that. I had this chemistry professor. I always go back to his story because his is my favorite. I had this chemistry professor who, and I used to be able to tell exactly what chemical he stepped in, you guys, and I can't anymore because I'm now officially old and don't remember that far back. But he stepped in a chemical and was getting sick. But he didn't realize that he kind of thought it might be from that chemical, but he wasn't sure if he was like had the flu or it was the chemical. And he went to the doctor, and the doctor was going to prescribe him some medication to counteract the poison or whatever. And the chemistry professor looked at him and he's like, "Are you kidding me?" He's like, "Do you want to kill me? I have heavy metal poisoning. That'll kill me." And it was only because my chemistry professor was a chemistry professor that he knew that that particular drug would have interacted with the heavy metal that was in his system, because he understood the chemical reaction that would have happened, that he was able to say that. The doctor had the doctor wasn't a chemist. He was just a doctor. I say just a doctor, but he didn't understand the chemical. So my chemistry professor refused the treatment and made the doctor go back and do his research to give him something that would have counteracted the heavy metal poisoning. But honestly, had he not pushed back or not been as knowledgeable as he was, he would have died. That's an extreme story. But I read stories about this all the time where people with our chronic illnesses have had to push back on doctors, especially new doctors, because they don't know the 10 years we've gone through of different treatments. They want to start from scratch and make us go through all those 10 years all over again.
Yeah. Yeah, I had an experience recently with one of the 3 surgeons that I saw for my hips. And one of the doctors was pretty pushy about wanting to do a hip injection. And I told him, I don't think I'm being clear that it's not necessarily the pain. It's more, the pain is more stiffness. It's the clicking and the band popping that's bothering me. And there was not a definitive answer that would say that would be relieved. And I said no, because if it was relieved, it would only be for 4 weeks. For me, that's not worth it. I have enough steroid in my system as it is. I did not want it. And he kind of pushed back a little bit. He's a wonderful, wonderful doctor, and I know he wanted to relieve my pain, but I was uncomfortable with that. And I pushed back and said, absolutely, under no circumstance am I going to do this. For me, this is not the right decision.
What happened that was right in both cases that fit within the Bill of Rights was the physician disclosed what they planned to do before they even started the course of treatment. Yes. That is also part of the Bill of Rights. They cannot start a course of treatment without telling you what they're going to do. And you have to be able to understand what they're going to do. So in both of these cases, the doctor said, this is what I'm going to do. And in both of these cases, they said, you both said no. And that is within your legal rights to say, no, I don't want it. So that is actually another part of the Bill of Rights. You have the right to refuse treatment. It is your decision. You have every right to decline treatment. In both those cases, though, the doctor was within the Bill of Rights to say, this is what I'm going to do. You want to read it?
To receive routine services when hospitalized at the clinical center in connection with your protocol. Complicating chronic conditions will be noted, reported to you, and treated as necessary without the assumption of long-term responsibility for their management.
Doesn't that sound nice and complicated?
Oh my gosh, how about it? But I mean, honestly, if you break it down, you have the right to receive any routine services that you would have been receiving out of the hospital in connection with your protocol.
Right. So it's just basically if you're taking certain medications, like the medications or treatments you would normally be getting when you're at home, you should also be getting when you're in whatever clinical care setting you're in, like the hospital or nursing home or whatever. So, this happened to my dad where he was hospitalized and they didn't give him his gabapentin the entire time he was in the hospital.
Oh, wow.
And then they were wondering why his neuropathy was so bad while he was in there. Well, yeah, you weren't giving him his gabapentin, people. Yeah.
I hate that when that happens at the hospital. A lot of the times when I've come in, I'm like, look, these are the times I take my meds. And when you first get admitted, it takes a while to get those meds up from the pharmacy. But then the next day when that's all sorted out, I expect to get my meds at the right times. Don't come in my room at 12, in the afternoon and give me my Synthroid. That is to be taken alone the first, when I get up in the morning, apart from my other medications. And I take that an hour before my other medications.
Yeah.
And I've had I unfortunately am on a lot of meds. So I know it can be complicated, but I still need to take my meds the proper way.
Yes. So it needs to be, and those complications, like Nicole's talking about, like if there's going to be complications, getting certain medications from the pharmacy, getting certain things to you, that needs to be noted. And it also needs to be treated in a way that's in a responsible way for you. So there are certain things that a hospital may not have available at that particular time, but that they need to get as soon as possible for you. If you get something from a compounding pharmacy, that's complicated to get for them.
Very. Because not all hospitals have compound pharmacies in their hospital.
Right. So there's certain ways those things can be handled, but that needs to be communicated to you, and things need to be worked out. So, all those things need to be worked out, but they need to do as much as they can to get your routine services handled as best they can.
Yes.
And there's just not many excuses for that. And especially with something like, I'm telling you, like with Synthroid and gabapentin, those are pretty standard drugs.
Yes.
They're
normally in stock.
So there's not many excuses for standard medications.
Yeah.
Okay. To know in advance what appointment times and positions are available and where to go for continuity of care provided by the clinical center. Who's available when and where to go. And you should be told, like, especially when you're getting discharged from somewhere, where you go for follow-up.
Or even if you're just going for one of your routine appointments, you should know where you're going, what building, what physician you'll be seeing. God forbid your physician got sick or got into an accident. They're supposed to notify you, hey, you're going to see his partner. Correct. And you go to the same building at the same time.
Or you have the option to say, I want to postpone that appointment. Right. To see my regular doctor. Exactly. Especially for us, because our situations are so complicated sometimes. We may not want to see someone new because sometimes it's just, do I really want to have to explain all this to someone else?
Oh my gosh, you spend like a half an hour just explaining who you are and what's wrong with you.
Like I remember, sometimes like I'll just get a like cold or a flu and going to see someone for just like, can you just get me something to like break up the sinus stuff, right?
Yeah.
And then you spend 40 minutes going through everything. And I'm like, dude, I just want something for my sinuses. Because suddenly you become a very interesting case for some of these doctors. And I'm like, no, I see someone for all of those other things. I just want something for my sinuses. I just want my regular doctor, go away.
And I think for a lot of us who are sick, like my doctor had an emergency one morning when he was heading into work, and they couldn't let me know until and my doctor's an hour away. So they let me know when I was like 5 minutes from the hospital. And I was very anxious because that physician that I saw, instead of my doctor, that's one of them that I haven't met. It was wonderful, actually. It turned out to be a great visit. But for me, because I have so many issues, I get super anxious when someone tells me I can't see my doctor who knows me.
That would make me anxious too.
Definitely.
If I was you, that would make me, depending on which doctor, that would just make, for my cardiologist, I'd be like, nope.
Mm-hmm.
Bye-bye.
Unless I'm in crisis, I'm waiting.
Exactly. So, but crisis is very different. Like when you're in crisis, that's a whole different situation.
Yeah.
Okay. The next one is to receive appropriate assessment of and treatment for pain.
This is very important.
Oh dear.
Especially with the opioid crisis and all the issues.
Yeah, I think we're going to need to do an episode soon on the opioid crisis, because this one is an entire episode in and of itself. It is.
We're just going to sum it up for you today, but we'll do an episode on it.
It's pretty clear what it is. You should be getting a proper assessment and treatment for your pain. This one can be complicated, though, in the sense of, I saw someone posted a sign. They went to their urgent care and it said, we will not treat chronic conditions here. At first, it sounds offensive, but then they're right. You shouldn't be going to urgent care for just a regular chronic issue. You should be going to your doctor for that. However, there are people that go to urgent care when their chronic pain gets out of control.
Right.
But then they go to urgent care and then they're treated like drug seeking.
Same with the ER.
Right. What one person actually suggested, which I really loved, was that they had a basically note from their doctor that explained their situation and what to do if the pain got out of control. And I thought it was a really nice, helpful solution. I don't know. It works for her in her area, and kind of her urgent care knows her by now. But it was a really nice, I think, way to show that, yes, I have this chronic condition. This is a real doctor who works in a real hospital right here. And this is our treatment plan. But I am and this is what he wants to do and me to do when I'm in crisis.
Mm-hmm. You can ask if they request to call that doctor.
And that's what that was part of the plan. And I think that was a really, really helpful solution. I don't know if it works for everybody, but I think it's worth a try.
Yeah, it doesn't work for everybody, unfortunately.
No, I mean, look, the opioid crisis has created a major crisis for chronic pain.
Yes. And it has tied doctors' hands.
Yeah. Because
which is unfortunate.
The CDC put down guidelines that did not take into consideration chronic pain patients. And it just put down these blanket guidelines. And there are appeals after appeals going into the CDC, and they have not been answered yet. Mm-mm. There are appeals before the board.
Mm-hmm.
They have not, there's no resolution to them yet. In case you guys didn't know.
Mm-hmm. Yeah.
There have been appeals scheduled, but there's no resolutions yet to the appeals.
Which is sad for people who have chronic pain and need to go and get sometimes more emergent treatment for, extreme pain. And really, they're kind of turned away, especially at the ER, unfortunately. Now, you can be, if your pain is so bad, they can actually admit you for pain control. But doctors' hands are still being tied in a lot of ways.
Yes. And honestly, sometimes it depends on the doctor you see. Now, here again is where we come back to considerate and respectful care. So this is where I do want to come back to that, because I have heard a number of people say that they have been treated very disrespectfully by doctors and nurses when they have come in with chronic pain. And that is just unacceptable.
Agreed.
I don't even care if you are a complete crackhead, drug addict, murderer coming in. you still have the right to consider and respectful care.
That's right. You are a human being.
And no, they don't get to play judge and jury to your pain.
Exactly.
They don't get to play judge and jury to what drugs you're on. They don't get to play judge and jury to anything.
Nope.
So yeah, you still get the right to have someone treat you that's considerate and respectful. And if they're not able to take their judgment out of treating you, then you need to have someone else treating you.
Yeah, I've had to actually take, when I took my friend in for her extreme pain when she had a severe herniated disc in her neck, and they were going to do surgery, but it wasn't scheduled for another week or two. We had to go to the ER. I actually had to take her to another hospital for her to get treatment. We had to leave the ER and go to another ER because the doctor was such an idiot.
Yep.
It was a horrible experience.
And you have the right to do that. You can sign yourself out AMA and go to a hospital.
But the insurance companies won't cover it. So they released her.
Well,
and you can say, okay, I'm not comfortable with it. And you both agree and you can walk away.
Actually, there's some debate on that. There is. You can sign out AMA. Yeah. So you have to check. You have to check.
Because like under Medicare, there's no exceptions.
Correct. But under some insurance companies, you do have the right to sign yourself out AMA. So you'd have to check whether you have that right.
Exactly.
Yeah. I mean, in her case, she was lucky to have you with her. Yeah. But
he's like, okay, we'll just, end everything. And, she's like, I'll just prefer to go to a different hospital. So she said, I'll get your discharge papers. And we were on our way, but it was still a ridiculous situation. He told her, he's like, well, I was in the military, and sometimes you just have to learn to let it suck. I looked at him and my jaw dropped open. I was like, are you really saying this to a patient when you know how excruciating this is? And this is a doctor that I knew before and that I really liked. He was actually a really good ER doctor. I don't know what happened. And I told him, I said, I am so disappointed in you. I said, I would have never expected this from you. Yeah, it was, and it scared me because this is a hospital I go to quite a bit. And so when he pops in the room, I'm like, sorry, next doctor.
Yep.
I will never trust you again.
I wouldn't either. And I don't think I would have been as nice saying I was disappointed in you. I think I would have been screaming it from the hallways.
I wanted to, believe me.
Yeah. So I think we'll explore pain on another episode and do much more in-depth discussion, because I know this is a really big issue for people.
Huge.
So the next one is to refuse to participate in research, to refuse treatment to the extent permitted by law, and to be informed of the medical consequences of these actions, including possible dismissal from the study and discharge from the clinical center. If discharge would jeopardize your health, you have the right to remain under clinical center care until discharge or transfer is medically advisable. So it's a little complicated in the language here. You have the right to refuse treatment is kind of the key in this. So you have the right to refuse to participate in any research.
Right. Any kind of research.
You into a research study.
Right.
They can't force you to take treatment, but they have to tell you when you refuse treatment what that will mean for you. So if you say, I don't want to do that, I don't want that treatment, they can't just say, okay, and then walk out of the room. They have to tell you what it means if you don't get treated. So it could mean if you were in a study, you voluntarily went into a study, they have to tell you could get kicked out of the study by not doing that particular treatment. They have to tell you that you might have to be discharged from where you are. They'll have to tell you if it could mean that you'll get sicker, mm-hmm. Or die.
Yes.
So they have to tell you what they think will happen if you don't take that treatment. That doesn't always, and I'm going to be very clear, that doesn't always mean they're right, by the way. Mm-hmm. So this is again why I say we sometimes know our bodies better. Like I say, if you know that a certain medication you don't react well to, and the doctor's like, but this medication will help you with X, Y, and Z. And you're like, I tried that medication 3 years ago and it does not help me with X, Y, and Z.
Mm-hmm.
Thank you for telling me you think it's going to help with that, but no.
Or another medicine that may have some component of a medication that you reacted to, but it's not the same medication, but you're still uncomfortable in the study with it. So you say, hey, you know what? I'm going to opt out.
Right. Like I refuse to take Lyrica. I opted for gabapentin over Lyrica because both my dad and my sister had bad reactions to Lyrica. And I was like, well, if both of them had bad reactions, I just don't think I'm going to have a good reaction to it. So I opted out from taking it, even though it's likely that it's a better medication. It's a newer medication. It's shown to have better results with some of the issues I have. But knowing that both my sister and my dad had these terrible reactions to it, I didn't want to take a chance on that. Like, why would I want to have a psychotic reaction in taking this?
Sure. It's your right not to want to take that chance.
No, I absolutely don't want to take that chance. I have enough issues as it is. Come on, guys. So I opted for something else instead, even though it might not be as effective. So yeah, you do have the right to refuse certain types of care. It doesn't have to be extreme, guys. It can be small things that you refuse. Sometimes it is extreme. Like Nicole was saying, you can opt to want to go to a different hospital. Mm-hmm. The key though is if they feel like it's going to be that big of something that's going to jeopardize your health, they can opt to keep you there until they can get your transfer set. Yeah. So like, they're not just, they can't just let you walk out of the hospital so you can die on their doorstep.
Right.
They're
still responsible for your condition.
Correct. So if it is something severe enough that you have to be connected to IVs and tubes, but you're like, I'm not comfortable with you continuing to take care of me. I want to be discharged. I want to go somewhere else. They can make that transfer available to you, but they will need to help you make the arrangements for that to happen in a way that will keep you alive while you get there.
Yeah.
So just understand that they're not holding you hostage. They just need to make arrangements for you.
Yes. Make sure that you're safe.
Yes. In that sense, they are taking care of you.
Yeah, definitely.
Yes. But you have the right to not see the doctor or nurse or staff or whatever that made you uncomfortable.
Right.
Mm-hmm. Okay. Next.
And you have the right to be transferred to another facility when your participation in the clinical center study is terminated, which is similar to what we just read, basically.
Yeah. Okay. So this is another one. So, we talked about HIPAA, but you should also expect that a medical summary from the clinical center will be sent to your referring physician. So wherever you go for care, outside of your, who referred you, you should know that they need to send their results to to the doctor who referred you.
Yeah.
So you should expect that. That is not a HIPAA violation, guys. That is part of what they're expected to do.
Yeah.
That is part of normal communication. And because your doctor's referring you there to find out test results to help figure out what's going on with you.
And your doctor needs to be aware of what happened at your other doctor's appointments, because this can impact the care they're giving you also.
I think that's why things like my chart are so amazing, is because it's an easy place for doctors to kind of see what's happening with you in a holistic way.
Yeah.
Not that all of them read it or check it or look at what's happening with you, even if they're all in the same center.
Mm-hmm. Well, it's nice that you can sign that. What's that thing that you sign I'm blanking at it right now, but it's basically that, like if I sign an Epic, like some of my doctors out here, all my doctors can see, no matter what system it is, they're all legally allowed to look at records from any provider. I signed off on that, which is awesome.
I signed off on that too.
Isn't it make things easier? It's awesome.
When you have a chronic illness, that is so essential.
Yes.
Because it all comes to one place. And now, I would love if all my doctors actually read all of those things, because I hate repeating myself. I do. I don't like repeating myself, guys. And I feel like doctors should be prepared when someone walks into their exam room. And I'm one of those people that gets snarky about it. Because I'm like, well, if you looked in the computer, you would see. If you prepared for the visit, you would know. Yeah, I'm obnoxious that way, guys. I've been this way my whole life. Sorry.
My doctors are really good about that. They're really anal retentive about reading, probably because I have like 1,000,001 problems and they're worried about killing me or something, but they always go into the previous doctor's notes and look everything up, which is nice.
Uh-huh. Yeah, not all mine are. Some of them are. Some of them are not. Some of them are better now.
Good.
Because I've had to teach them.
That's good.
That I don't tolerate it. No. I mean, look, I sound snarkier than I am. I'm nice about it, but it's a slow education. Mm-hmm. And it's okay to teach your doctors what you expect. Mm-hmm. That's also fine too. They learn. If you're nice about it, they will actually respond to that. I sound snarky, but I'm actually really nice about it when I'm in there. I sound snarkier when I'm talking on the podcast than I am when I'm in the doctor's office. I'm actually very nice. But I feel like it's an educational process with some of my doctors.
Yes.
It's something that, but your doctor should be getting these updates. Like I know that I've gone into my primary care office and after a couple months, she's like, I've been getting updates from all these places. I'm like, oh yeah, you should be.
You know what? I didn't realize, I forgot I signed this, and I walked into one of my doctor's offices and he goes, how long have you had the medical cannabis? I was like, what? How did you know that? I was kind of taken aback by he didn't care, but I mean, like I forgot I didn't tell him, and he was like, I didn't know you had medical cannabis. And I said, yeah. He was like, okay. He just wanted to bring it up. Yeah, just to make sure that I wasn't having problems with it or anything. So, but I was so taken aback. I'm like, how do you know my business?
Yeah, because you forget you signed it. You forget your doctors can be all up in your business.
That's right.
Yeah. It's interesting, guys. The only thing I don't expect them to know are like my dental appointments, because that's different. But they do know, because I have no problems being like, and because I have EDS, I have all this stuff with my teeth. And and they're all like, we don't care about your dental health. And I'm like, you should care about my dental health, because your gum health affects your cardiovascular system. Right. See, they're so dismissive of dentists, guys, really. Like, you start talking to like MDs about dentists, and they just are like, yeah, they're people who couldn't make it through medical school. I'm like, but they're so essential.
Oh my gosh, dental school is brutal.
Yes. And they dismiss dentists. It's so like, seriously, like anyone in like the medical field, it's brutal. They all judge each other.
Oh my God, it's terrible. It's uncalled for, and it really makes the work environment terrible. And that's what people forget.
I don't even want to call them sharks. They make sharks look like guppies.
Oh my God, it's so true. It's so true.
Seriously. Okay. And then the last one, to designate additional physicians or organizations at any time to receive medical updates. You have 100% the ability to designate anyone. Well, this is the last one on there. There's a couple more I want to go over. You have the right to designate other people to receive your medical updates. So there's people like patient advocates, there's your caregivers, there's there may be nursing home personnel, there may be, you just have the right for other people to have access to your medical records.
I can say I want it sent to my rheumatologist, my primary care, you know what I'm saying? All my doctors.
Yeah. Just so you guys know, you have the right to appeal. You have a right to a fair review or appeal of any complaint against a doctor, hospital, or healthcare provider. Mm-hmm. So you always have that. That's very important. So if you don't feel like you were heard properly, you have the right to appeal that. And that's, you can appeal any complaint about the adequacy of your treatment, the actions of any healthcare personnel. Again, we're not just talking doctors or nurses, it's any healthcare personnel. Wait times, you can complain about wait times. Be reasonable on wait times, guys, because look, if I'm very patient, if a doctor has a legitimate emergency, like if you start hearing codes in hospitals, be patient.
Yeah.
Because a code is always going to take a priority over you.
Always.
That means someone's dying.
Mm-hmm.
Right.
Mm-hmm.
Or you start hearing ambulances hit the front of that emergency room, you know you're going to be there for a while.
Mm-hmm.
Because
a lot of people down south are experiencing that right now with all the hospitals being filled up.
Yeah. So be a little patient with wait times. There's legitimate reasons for wait times, but then if you're sitting in a quiet ER and you're sitting there for hours wondering what's going on, you kind of have a reason for a complaint.
Yeah. I'm like, search Amazon on your own time.
Yeah.
You know, unless they're waiting for the test results to come back, that's different.
Right.
But to initially see you, and then you're like one of 2 patients in the ER, this should move pretty quick.
And you have every right to ask why you're waiting so long, and ask them what's going on. Because I've asked them and they're like, oh yeah, we're waiting for your test results. It may not look busy here, but they are totally swamped. There's only one tech working X-ray, and there's only one tech working X-ray for the entire hospital right now.
Right. And you're going to wait.
Yeah. And so then you realize, oh, okay, it's going to be a little while.
Yeah. And like Kelly said, please try to be patient. I had a friend that told me the other day when she was working in the ER, that a patient, she called and said, why am I waiting so long? And she explained that the patient next door had coded. Because the woman could hear it. She saw everyone run in there. And she said, we're in an emergency situation right now. And she said, that's not my problem. The patient was a complete idiot. And it was so rude. And people can be so ignorant sometimes. So in those kind of situations, don't be ignorant. You know, you need to wait sometimes.
Yeah. So there's legitimate complaints about wait times. There's not. I mean, I do the same things when I look at people's reviews on Yelp. There's legitimate complaints about doctors' offices. And then there's like the stupid complaints.
Oh God, so true.
You know, because I do a lot of research on my doctors, and I look at like everything from health grades to the board ratings to Yelp reviews. And I see what people are complaining about. And I'm like, seriously, that's your complaint?
Yeah.
Like, I mean, I've seen
room was too bright.
Yeah, I know. And I've seen them complain about the artwork on the walls.
So have I.
The artwork was too depressing. And they give them a 1-star review. And I'm like, and you can't remove the reviews.
No.
So it's like ridiculous stuff. Or, you know, I was put on hold for too long. Or like I called 3 times on a Sunday afternoon to a doctor's office. Like, of course you're not going to reach them. It's a regular doctor's office on a Sunday afternoon.
Yeah.
Oh, okay. So yeah, be reasonable. And that also goes, again, like I just said, operating hours. Have a reasonable understanding of operating hours, but you also have the right to appeal if they're not working during what they state are their operating hours.
Yeah.
You know, if they have posted operating hours and they're not operating during those operating hours, you have a right to complain. And then billing and payment issues. You have a right to know what you're being billed for.
Mm-hmm.
You have a right to see your billing.
Mm-hmm. You have a right to know what codes they used.
Yes.
Because a lot of times I've had things kicked back. Yeah, I've had things kicked back because they didn't code lupus. They coded another condition or something, and it got kicked back because that treatment was specifically for lupus. So I had to call, and you guys, you can Google ICD-10 codes for your disease process. And sometimes coders are human too. They may accidentally put the wrong code. The bill gets kicked back. You need to make sure you're looking through these things so you're not paying unnecessary bills. I
mean, literally, it can be the difference of one number. And you guys, these coders that's all they're doing all day long. It can be a very simple mistake. Don't freak out. All you have to do is call, it's usually pretty easy to resolve a coding issue.
It is.
And it's very simple to take care of. I've had to take care of that. And it's been very simple for me to take care of a coding issue. Like, why was this? And they should be able to answer why something was kicked back or why something was coded a certain way. And yes, things can get kicked back because it needs to be coded one way and not the other way. Insurance companies are very, very picky on these things. You can ask for payment plans at most hospitals. So, you can talk to people about payment plans, billing issues,
financial assistance,
all of those things. If you're not getting assistance you need that is available, that's a valid complaint to make. And you have a right to have those complaints. If you aren't getting things resolved, absolutely, you have a right to that complaint. Absolutely.
Absolutely.
If Nicole had called and said this was supposed to be coded under lupus because she has lupus, and they said no, she would have a right to a complaint.
Yep.
There are, you guys, some bad apples in the bunch. We know this.
Yeah, in any field.
So there are going to be times you have to file a complaint. And then if you file a complaint, then yes, you might have to work with your insurance company to know that you're filing a complaint. And it gets complicated, guys, but don't hesitate to file a complaint because it's going to get complicated.
Right.
Especially when it comes to billing and payment.
Absolutely.
That's really, really key. The other thing is to know you also have responsibilities under the Patient Bill of Rights. It is not just about the doctors, the hospital staff, nurses, and all that. You have to be an active participant in your treatment plan.
Mm-hmm.
You cannot sit there and not take your medications and not do anything or pull out all your tubes or anything like that when you're sitting in the hospital. You have to be an active participant in your treatment plan. Mm-hmm. Guys, that is part of the Patient Bill of Rights. You have to be respectful of the staff in the hospital.
I was just going to say that.
Like I say I am snarky with doctors and stuff like that. And I talk back, but I do it in as respectful a manner as I can until I really, really need to get my voice heard.
Yeah, me too.
Like until I finally hit my last exasperated wall, and then the world is going to hear. And pretty much like how I'm talking right now is how the world is going to hear, but I get a little louder. I'm not throwing hissy fits in the hall and running up and down and screaming.
Nope.
I'm just a little bit loud and very firm.
Mm-hmm.
A little Karen-esque. Hate to say it, guys. Sorry. And also dyed my hair blonde now. So now I'm really officially like stereotypical suburban Karen. But yeah, you need to be as respectful as possible. And, and like I say, you catch more flies with honey than vinegar. So you start off really respectful. You make the request. You go through the proper channels. It's really going to get you a lot further normally. Mm-hmm. You can be firm, yes, but respectful.
Yeah, because you'd be surprised the things that come out of patients and their families' mouths for absolutely no reason. Yeah. You look fat in that uniform, or I don't like your hair color, or you just out of the blue.
Yeah, what does that have to do with anything?
Look. Yeah, people are nasty. I could tell you stories. They're just nasty. And there's no excuse for it because they were getting good care.
Yeah, I mean, if you're going to argue, if you're going to be mean, like if you're going to finally get to that point where you're like, I am so angry right now, it should be about something valid.
Oh, yeah.
You should, whatever comes out of your mouth should be something valid. Like I will actually say to the staff, I want you to know how angry I am right now. Yes. How angry I am at what is happening at the moment. And this needs to change. This is unacceptable. The care that I am receiving is unacceptable care. Mm-hmm. And this is why. X, Y, and Z is why. I will outline the reasons why I think it's unacceptable. They will know exactly what is wrong. And that is it. I don't care what they look like, who they are, what is happening. It is about the care and the care only. Fight fair, guys. Fight fair.
Yes, please.
Because that is a respectful fight. It should not be about what they look like. No, no. It should not be any of those things. Fight fair. Okay. And then also a timely resolution of your financial obligation. So yes, I know that a lot of us struggle with medical bills, job situations, and all that. This doesn't mean you have to have a zero balance with your physician, your medical care center, hospitals. Because like right now, people are racking up $1 million bills with hospitals with COVID.
Oh God, they really are.
And I don't know how some people are going to pay any of this.
I don't either.
And I know a lot of people who are probably listening are thousands upon thousands of dollars in medical debt. That doesn't mean that you're not trying to pay it off. Hospitals will respect if you're making an effort to pay off your financial obligation.
Mm-hmm.
Your healthcare providers will respect if you're making efforts, right? They're not saying you have to have a zero balance. They're just saying you need to be making efforts to pay off financial obligations to them. So that you're not like ignoring it completely. So those are some of the patient obligations.
Yeah.
So you guys, that's the patient bill of rights. It sounds like, an emergency. Did we go for emergency treatment? The people have the right to emergency treatments, whether they can pay or not.
Oh, no, we didn't say that.
Yeah, that's the last one. Sorry, guys. I think we almost forgot that. And that's really important.
Very important. Yes, very, very important.
You have the right to emergency treatment, whether you can pay or not.
Always.
Oh, gosh. Yeah, that's really important.
And you've seen on the news the lawsuits of hospitals who have like left people outside and like different things have happened. But you have the right. If you come in and you don't have insurance and you're having an emergency, they still have to treat you.
Yes, they do. And they have to treat you just like they treat
everybody else.
They cannot ask you if you can pay. They have to treat you. Mm-hmm. So, yeah, that is also really important.
Yes.
Don't forget that one. That's like a big one. Yes, they can bill you, but they have to treat you. They can't turn you away. Mm-mm. All right, guys, that is a long list. I need a fan. Ooh, I'm hot.
Yes, it was a long list.
Okay.
Good to know, though.
This was you guys. This is really important. I think. I really want everyone to make sure that they know their rights when they go in to a doctor. I want you guys to, as the Beastie Boys say, fight for your rights. Just the first half, not the second.
Yeah, the party too,
just fight for your rights.
That's right.
And because I want you all to be able to take care of yourselves. I want us all to be able to take care of ourselves. We're already in a disadvantaged spot because we have our chronic illnesses. We're already in pain. We're already struggling with our bodies. We're already, seeing 8 million doctors. And a lot of times we see new doctors who don't believe us, and it's hard enough as it is. So knowing your rights, I think, gives you a leg up.
Yeah, I agree.
When you're being treated.
Absolutely.
Knowing you have the right to respect, knowing you have the right to emergency treatment, knowing you have the right to see your treatment plan, to see what they're diagnosing you with. I think all
these
of
are
those
important things. Yes.
Nothing should be kept secret from you guys.
Nothing.
That transparency is really important. So, all right. I hope we left you guys with really good information this week.
Yeah. Thanks for listening.
Thanks for listening, guys. And we'll chat more next week.
Yes. See you next week.
All right. Bye, everyone.
Bye.